Thank you for joining us today to discuss Medicare coverage of lung cancer screening and counseling to prevent tobacco use. My name is Karen Curtis and I will be your presenter. I'm joined by Aline Ziegler, who's going to be helping me out by monitoring the chat and helping with any issues that may arise. So I would like to thank her for being here today. November 20th is the Great American Smokeout, so I thought it was appropriate to cover lung cancer screening and counseling to prevent tobacco use for this month's Preventive Services webinar. Now, my goal is to increase your knowledge on the coverage criteria for these services and how to submit those claims to Medicare. I'm going to do this by discussing coverage criteria, coding, and how to check for eligibility. Now, when looking at rejections for these services, the majority are related to frequency and not billing with a covered diagnosis. So I want to make sure that I provide you with the information that's going to help you get those claims billed correctly. I'm going to start off with a little general information and statistics. Now, there are two types of lung cancer. Non-small cell lung cancer is the most common, and it accounts for 80 to 85% of all lung cancer. Most non-small cell cancers are associated with cigarette smoke, and it can be found in patients who have never smoked. These cancers are less sensitive to chemotherapy and radiation, and while this cancer may be controlled with radiation therapy, it is rarely cured. Small cell cancer is less common, and it accounts for 10 to 15% of lung cancers. Small cell lung cancer tends to grow and spread faster than non-small cell cancers. Many times the cancer has spread beyond the lungs by the time the patient is diagnosed. Now, unlike small cell cancer, this type of cancer does respond well to chemotherapy and radiation therapy. Smoking tobacco is the most common cause of lung cancer. For those who are non-smokers, researchers list environmental factors such as exposure to radon, secondhand smoke, and air pollution, which can contribute to the risk of developing lung cancer. Workplace exposure to asbestos, diesel exhaust, or other chemicals can also have an effect. Genetics can also come into play. There are both inherited and acquired gene mutations that may affect your risk for developing lung cancer. I always like to throw in some statistics in my preventive services webinars to show the importance of receiving these services. Now, while lung cancer is the second most common cancer in the United States, more people actually die from lung cancer than any other type of cancer. Smoking does remain the highest cause, contributing to 80% of deaths. Lung cancer usually occurs in older people with an average age at the time of diagnosis of being 70. Now, the American Cancer Association estimates that there will be about 228,650 new lung cancer cases in 2025 and about 124,730 deaths. I was actually a little bit surprised because these numbers have slightly decreased from last year, so hopefully things are working and people are getting healthier. The chances of men developing lung cancer in their lifetime is about 1 in 16. For women, it's 1 in 17. And when broken down by race and sex, cancer rates are higher in Black men and white women. Now, the good news is that smoking rates are going down. I've noticed that where I live in Nebraska, you definitely don't see as many people smoking in public as you used to. Smoking is down 73% in adults and 86% in youth. So let's move into Medicare coverage. I'm going to start out with lung cancer screening. Lung cancer screening is covered under Medicare Part B, and it should be between the ages of 50 and 77 for patients. Patients do not have to show signs or symptoms of being lung cancer in order to be covered. They should have a smoking history of at least 20 pack years. So now you may be asking yourself, what does that mean? A pack year means a person smokes 1 pack a day every day for a year. So a 20 pack year would mean that the patient smoked a pack a day every day for 20 years, or maybe the patient smoked 2 packs a day every day for 10 years. Both of those would be examples of 20 pack years. Now, the patient should be a current smoker or someone who has quit within the last 15 years. Lastly, they must receive an order for lung cancer screening with low-dose computed tomography. This service is covered annually, which means that 11 full months must have passed since the last screening was done. For instance, if the patient received the service in January of 2025, you would start counting the 11 months in February. So that means that the patient would not be eligible to receive the service again until January of 2026. Coinsurance and deductible do not apply to this service. Now, there are some additional requirements that you will find listed in NCD 210.14. And it is that prior to the patient's first cancer screening, they must receive a counseling and shared decision-making visit. This should be documented in their medical record. Now, during this visit, there should be a determination as to whether or not the patient is eligible. There should be conversations to determine if performing lung cancer screening is right for the patient. This would include the use of one or more decision aids. Now, you can find these on the internet, but I am going to have a link into it's a decision aid that was put out by the American Cancer Society. I do have it here, just one moment. So this aid also contains an area where you can calculate how many pack years. So this is something that could be used when you're having this counseling session. The counseling should include a conversation about the importance of adhering to an annual screening, as well as the ability or willingness to undergo diagnosis and treatment. Let me get back to the presentation here. Staff should also counsel on the importance of staying smoke-free if dealing with a former smoker, or educate on the importance of quitting smoking and offering information of tobacco cessation. Additionally, takeaways from the NCD are that the reading radiologist must have board certification or board eligibility with the American Board of Radiology or an equivalent organization, and services must be provided by a radiology imaging facility that utilizes a standard lung nodule identification, classification, and reporting system. So now we're going to take a look at billing those claims for the lung cancer screening. Now here I have listed out the billing specifications. Code G0296 would be used to bill the counseling and shared decision-making visit. Then code 71271 is for the tomography. I've listed diagnosis codes that would be appropriate for this service. I had mentioned earlier that not using a covered diagnosis code is one of the top reasons for this service being denied. So you'll want to make sure that you are including a code listed here when submitting your claim. Now, if you are an institutional provider who bills on a UB04 or an 837I, I've provided a list of applicable types of bills. You will notice that Rural Health Clinic type of bill 71X and Federally Qualified Health Centers type of bill 77X. It does say code G0296 only. That is because rural health clinics and federally qualified health centers are only going to receive reimbursement for that code G0296. So since smoking is the #1 cause of lung cancer, I did want to include coverage for helping beneficiaries quit. Now, counseling to prevent tobacco use is covered under Medicare Part B. The beneficiary must use tobacco but does not need to have signs of tobacco-related disease, such as chronic obstructive pulmonary disease or COPD. The patient should be competent and alert during counseling sessions. The counseling should be provided by a qualified physician or other Medicare recognized practitioner, such as a physician's assistant, a nurse practitioner, or a clinical nurse specialist, just to name a few. CMS allows 2 individual counseling attempts in a 12-month period. Each attempt can include a maximum of 4 intermediate or intensive sessions. An intermediate session would last more than 3 minutes but less than 10, and an intensive session would last more than 10 minutes. Beneficiaries may receive another 8 sessions during subsequent years after 11 full months have passed since the first Medicare-covered counseling session was performed. So again, to start the counting for that second subsequent 12-month period, you're going to begin with the month after the month in which the first Medicare-covered counseling session was performed, and then count 11 full months going forward. Coinsurance and deductible do not apply to this service. Now we're going to move on to billing those claims. Now, if you are billing for intermediate sessions, you're going to use code 99406. Sessions that are greater than 10 minutes would be intensive, and those would be billed using code 99407. Evaluation and management services can be billed on the same day as a tobacco cessation counseling service, as long as it is clinically appropriate and medically necessary. You're also going to want to use the appropriate code along with modifier 25. Now, there are quite a few diagnosis codes that might be appropriate, so I have included a link to the Medicare Claims Processing Manual, Chapter 32. Section 12.1 does provide a list. Now, if you don't normally use the internet-only manuals, I will show you how to get there. From the cms.gov website, we're going to click on Medicare, Regulations and Guidance, then to Manuals. Over here on the left, we have Internet-only manuals. This is going to be the Medicare Claims Processing Manual, and we're going to go down to Chapter 32. Now, Chapter 18 is where you will find most of the information for preventive and screening services. This particular service is down in Chapter 32, which is billing requirements for special services. Okay, we just happened to open up right where the diagnosis codes are. So here is the whole list of diagnosis codes that can be billed for this service. I also wanted to show you this is also where you will find information about billing for evaluation and management. So that information is out there also. Now, if you are a provider who bills professional claims on a CMS 1500 or an 837P, services should be billed with the type of service of code 1. Institutional providers should use one of the types of bills that are listed here. You can see that there are quite a few different facilities that can bill for these services. Rural health clinics and federally qualified health centers are going to want to use revenue code 52X when billing for these services. Critical access hospitals, method 2, would choose the appropriate revenue code listed on this slide, while all other providers should bill using revenue code 942. Now, frequency rejections was also high for these services, so I want to make sure that you know how to check for eligibility. Now, there are a few options available. For those of you who have registered for the secure section of our website known as the portal, there is a Preventive Services tab that's located within the eligibility check, and it's going to show HCPCS or CPT codes, and it will have the next eligibility date. If you are a provider who uses the Fiscal Intermediary Standard System, DDE may be an option. Lastly is the HETS or HIPAA Eligibility Transaction System. This is an option involving the electronic data interchange of files. So a 270 file is sent to request eligibility information, and providers will receive a 271 response file showing those next eligibility dates. This does require your facility or office to be enrolled for electronic transactions through our EDI department. Now, the WPS portal I had mentioned does have an eligibility check for patients. At the top of this slide, you will see the tabs for all of the available information. Tabs that are shown in blue means that there's information available, while tabs that are shown in gray indicate that there is no information available. The Preventive Services tab is white with blue wording because that is the tab I had selected. Now, the page lists all of preventive services that have frequency limitations. The bottom of the screen just shows the lung cancer screening as an example, but there could be just multiple listings. The service is going to be listed above the box, and then it's going to show you the procedure code that was billed, if there was a modifier used, the next eligible date, deductible amount, deductible remaining, and coinsurance amount. So using that next eligibility date is going to allow you to avoid those frequency rejections. The eligibility check function is available to all users regardless of access level. So you could be eligibility access standard or MPI administrators. Everybody would be able to check this information. Now, I have provided some resources that will provide you with additional information related to both lung cancer screening and counseling to prevent tobacco use. I would like to take you out to the Medicare Preventive Services tool because I think it's helpful regardless of what service you are looking for. This is this very top link here. So this can be used regardless of what preventive service you're trying to find information on. I would like to take a look, or I will say that it does have all the information in one place. We'll look first at like tobacco, counseling to prevent tobacco use. It has a link to the NCD, so any of these services that have an NCD associated with them, there will be a link on this tool. It gives you the codes to use. Here's another place where it's going to list all those diagnosis codes for you so that you can make sure that you're billing with one that is covered. It tells you the criteria for Medicare to cover it. It gives frequency information. patient pays. A lot of times in this other notes, it'll give you additional information. Sometimes it'll give you links to other material. The other thing I do really like about this tool is this box that says what changed. So it tells you that the last update was that it added this diagnosis code and that it was effective October 1st, 2024. I have found that there are times where this tool is updated before the internet only manual is updated. So that's just something to throw out there because you could find more up-to-date information here. And then if I select another service, the lung cancer screening, I'm sorry, I'm trying to scan too fast. Here, for both of these, you actually see the T with the circle in it. That means that they are eligible for telehealth services. Again, we have the NCD link. This tells you no changes were made, but here we kind of have the same information. So I just wanted to make you guys aware of that because I do think it's very helpful. Now, before I ask Elaine if there's any questions that have come through the chat, I do want to address a couple pre-submitted questions that I did receive during registration. The first one is in regard to documentation requirements. Now, our teammate Jennifer did hold a webinar this morning on the clinical aspect of lung cancer screening. She usually covers documentation, so if you missed her presentation, be sure to look for it as an encore. I am going to go back to the Medicare Preventive Services tool, and we're going to take a look at the NCD associated with the lung cancer screening. Now, of course, you are going to want to document that your patient did meet the criteria that's listed here, but under here, under this counseling and shared decision making, it does state that the beneficiary must receive a counseling and shared decision making visit that meets all of the following criteria and is appropriately documented in the beneficiary's medical records. I brought this out and to tell you about because you're going to want to make sure that you meet these 4 bullets. Since the NCD is specifically telling you that it should be documented, you're really going to want to make sure that that's all covered in your documentation. You're also going to want to make sure that the facility that you are using meets the criteria listed down here, that the reading radiologist meets the criteria. So that's the main thing that you're going to want to look at when you're wondering what you should put in those patient records, is that you are documenting the requirements that the NCD is asking for. For counseling to prevent tobacco use, we'll go to that NCD. You will want to document that your patient meets the criteria listed and that the counseling was furnished by a qualified physician or other Medicare recognized practitioner. The Code of Federal Regulations, I always wonder when Medicare uses terms like other Medicare recognized practitioner. So a lot of times I'll go to the Code of Federal Regulations to see if I can find a definition. And it does define practitioner as an individual credentialed within a recognized healthcare discipline and involved in providing the service of that discipline to patients. So I don't know if that necessarily helps, but that's the definition we're giving. Since these codes that you use for billing are time related, I would definitely make sure that you document that if you are billing for an intermediate session, there's documentation showing that it lasted more than 3 minutes but less than 10. If the claim is showing an intensive session is being billed, then you're going to want the documentation to reflect that the session lasted more than 10 minutes. So that's what I wanted to provide as far as documentation. I was also asked another question about if the services are payable over age 75. And for lung cancer screening, patients may be eligible up to age 77, but I have been told by some providers that there are Medicare Advantage plans that will cover the service up to age 80. So it's probably just going to depend, are they using regular Medicare or do they have a Medicare Advantage plan? And if so, what's that plan's criteria for coverage? Now, counseling to prevent tobacco use does not have an age requirement, so everything would be good there. That does do it for the pre-submitted questions that I had not answered during the presentation, so I'm going to ask Aline if anything has come through in the chat.
Hi, Karen. Thanks for that great information. I don't have a question, but there was a question about the presentation materials, saying today's presentation has different slides than what's on the training center. And I did put this in the chat for everybody, but just so everybody's aware, and you already mentioned that there was a clinical session earlier today. So there's two webinars that might look similar in their description, but you'll want to make sure that you're getting the slides for this later presentation. And I did verify that they are correct, but just in case anybody else went out there and was confused about that, I just wanted to mention it.
Sure, we can go out there. For this particular presentation, if you go to the training center and then go to the live events, here is the Preventive Services for Lung Cancer Screening. This is the webinar that Jennifer held, and that was this morning at 9 a.m. Till 9:45. This would be the link for the presentation that I just provided. So this would be the one that I showed. So hopefully that will clear that up.
Yeah, thank you. And we don't have any other questions in the chat at this time.
Okay, thank you very much. When you disconnect from the webinar, you are going to be redirected to a CMS survey. I'm also going to have Aline add a link into the chat. And I really do hope that you'll take a moment to provide feedback on how I did today. If you are watching this video as an encore, the link can be found in the description of the video. The redirect is going to look like what you see over here on the right. We do not have any control over how this appears, so we just want you to know that this isn't spam or anything malicious. If you click that blue continue button, it's going to take you to the actual survey. Now, the feedback that we receive does lead to changes. Chapters had been added to our encore presentations in YouTube, and these timestamps can be found in the description. And it not only gives you an overview of what's being covered, but it allows you to jump to points in that video that you might most be interested in. We also added training indicators to the description of our webinars to help you decide if the material applies to you. Now, while you can usually tell from the title, the training indicators can provide additional details. So maybe we might have something that's only related to the FIS system or MCS. We can add those to the description so that you'll know, like, I bill through MCS, I'm not going to go to something that's specific for FIS. Another thing that we have done with the survey results is we have held 2 Medicare education expos that were based on suggestions for future education topics. We are currently planning a 3rd one to be held in January. So I just wanted to let you guys know that we do take your comments, and we do try to use them to provide things that you would like. So as you can see, your opinion really does matter. Now, after disconnecting today, you are going to receive a thank you for attending email, and that's going to contain contact hours that can be submitted for CEUs. If you joined only by phone, WebEx is not able to generate this email, so you will need to contact us at wps.gha.education@wpsic.com. And please include your name and the phone number that you used to dial in so that a certificate can be sent to you. Now, if you think of any questions that you have, those can be emailed for up to 7 days following this event. And that is going to bring us to the end of today's presentation. On behalf of myself, Aline, and the Provider Outreach and Education team, I would like to thank you for being here today, and I hope that you will join us for future events. You may now disconnect.